This episode of Transmission Interrupted was recorded April 24th, 2026. This is Transmission Interrupted, a podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETEC.
Hello, and welcome to Transmission Interrupted. My name is Jill Morgan. I'm a nurse here at Emory University Hospital in Atlanta. For those of you not yet familiar with NETEC, our mission is to set the gold standard for special pathogen preparedness and response across health systems in the U.S. with the goals of driving best practices, closing knowledge gaps, and developing innovative resources. NETEC works alongside and in cooperation with the CDC and is funded by ASPR, the Administration for Strategic Preparedness and Response. So we are in World Cup prep, and I am thrilled to have with me today Dr. Laura Evans. Dr. Evans has an illustrious history that many of you may be familiar with at several facilities across the country, but right now she is in this role as the Executive Director of the National Special Pathogen System, which is just so exciting as we launch into this idea of having something like the trauma system for special pathogens. And we're here today to talk about preparedness and World Cup and the kind of pathogens we have to worry about with the World Cup visitors. And I am thrilled to have Laura with me today. So welcome.
Thanks, Jill. It's great to be here with you. I think I'm as excited about the World Cup as anybody else, mostly to watch it.
Yes. So thinking about World Cup, right now, we're still 2 months out from the first games, but people will be coming in teams and then games are scattered across the country. So there's a lot of moving parts to this. But we're going to talk about the parts that might impact healthcare systems. And so what do you think emergency departments and urgent care should be thinking about with this influx of visitors? So the fans who are coming, and of course, I assume teams travel with their own medical teams, but who knows who's going to be with them or who's going to be needing medical care that goes beyond what their team doc may be able to provide.
Yeah, it's a great question. And I guess from my perspective as the new executive director of the NSPS, and given my background with work in a biocontainment unit back in Bellevue years ago, my lens is obviously drawn to the infectious disease lens of it, although I'm not an infectious disease physician by training. But I think anytime there is a large influx of tourism from very large geographic areas across the world, there's probably a range of things that emergency departments need to be concerned about. Infectious diseases is one component of that. But anytime there's mass gatherings, I think emergency departments go on prep for many things, right? And you think about things that we consider like maybe a little bit more mundane than infectious disease outbreaks. Like, is it going to be exceptionally hot in one of these areas where the games are happening? I'm looking at the list, right? There's a lot of places that could be quite warm in late June and early July in the U.S., yes. Right? Dallas, Houston, Atlanta, Miami. There's lots of potential for a spectrum of things to present to the emergency departments. I know we're probably here mostly to talk about the infectious disease stuff, but I think EDs are doing a ton of prep across the board for an influx of people with all types of potential illnesses that could present to the ED.
It's a good point that we don't want to get so caught up on thinking about, oh, we could get an Ebola patient. Well, the odds of that are super small. But yes, people may not be familiar or acclimated to the temperature and the humidity in some of these places, because Atlanta, I love the phrase, which is actually stolen from a novel. Atlanta in the summertime can feel like walking into the mouth of a panting dog. Oof.
That's very vivid. Thank you for that.
It is. The moisture hits you in the face when you open the door and you're like, oh, I can't imagine. So I know that, for instance, when we had the Olympics here many years ago, they had these misters out, and I was not thinking so much about infectious disease then, but now I think, where's that water coming from? Like, where are you misting people from? But yes, so we don't want to forget the very common things. And of course, as we mentioned, we had the opportunity to talk to Alex Isikoff about Then it will be flu season for some of the people who are coming up. So just the routine stuff is still certainly possible to see. When we think about the countries that are coming, are there pathogens that you're concerned about? And not just high consequence infectious diseases, but the other things that might be common in those countries or endemic in those countries that people should be at least having in their list, in their mental list.
On your radar, so to speak.
Yeah.
It's a great thing to think through, right? Because you think about the Olympics, for example, as another kind of correlate to this, right? But where you're bringing people from every region of the globe, you really do have to think broadly about what are the potential things I should be concerned about, right? And so I look at a couple sources, right? Because I don't think there's sort of like one single source of truth out there for every outbreak across the globe that we should be worried about. And so I look at a few different sources to try to get ideas about where things are going on. We have the resources of the CDC. I'm also a big fan of the resource that Nahid Badilia's group at BU has developed called Beacon, which is a nice conglomeration of many news sources to look at potential infectious disease events globally. There's a few things that come to my mind, and I kind of separate them as you do, I think, into endemic infections or things that we wouldn't necessarily put in the bucket of a high consequence infectious disease, but that can cause disruption to the healthcare system, and we need to be vigilant for. Measles is an obvious one, right? We have transmission here in the US of measles. There's lots of sites globally that have transmission of measles. So I think measles for sure. Not classically a high consequence infectious disease, but boy, is it disruptive to your healthcare system if we don't have good processes in place to identify, isolate, and inform.
Right.
I've been, I guess I'll call it the opportunity to have experienced multiple kind of case tracing measles events through healthcare exposures. And I would prefer to avoid those. They're not that fun. So measles for sure. You already mentioned influenza, right? We're going to be out of our quote unquote seasonal influenza season in the US, but obviously regions of the world that experience different seasonality than we do may have influenza transmission at that time. And then I think about getting into that outside of our normal spectrum, kind of the idea of other respiratory viruses, right? We're certainly looking at novel influenzas and highly pathogenic avian influenza. And some areas of the world are seeing some human cases, not a lot of human to human transmission, but I think it certainly should be on our differential as we think about people presenting with respiratory illness and take a good exposure history for where people have been, what have they been exposed to. I think even several months ago now, where I am in Washington State, had a case of a novel influenza that took quite a while to recognize.
Yeah. Since you mentioned these sort of novel influenzas, respiratory illnesses, and thinking about people coming from other places, I know COVID we can't put in the past tense, but when the outbreak was occurring, we were sort of all watching on an almost daily basis the changes in the genome of what was circulating. And it occurs to me now, thinking about this, that we will have people traveling with their own version of COVID, perhaps, and one that maybe we haven't seen here or that my immune system hasn't seen before. So do I also have to think about what to me has become sort of this universal respiratory concern? You hear somebody coughing. I mean, I know I do the mental math, right? I'm walking down the hallway, somebody in front of me coughs, and I hold my breath and do the math. Can I walk through that cloud of dispersed aerosolization before I have to breathe again? Certainly, COVID is always out there now, and it doesn't seem to have the same waning that the flu does.
Yeah, it seems to have a little less of this very clear seasonality pattern to it, right? Fortunately, most of these events are outdoors. Even probably a lot of the watch parties are outdoors, but we're going to have people in sort of concentrated areas. So I think we do have to be generally aware of our surroundings and think about what your personal threshold is for putting on a mask and wearing respiratory protection. And I would certainly encourage people to do all the common sense things that if you feel ill, don't go to the mass gathering. Certainly wear a mask around other people, right?
Yes.
In the NETEC frame, right? So I think about respiratory pathogens and I think about pathogens that may be transmitted via contact, like the viral hemorrhagic fevers. And I think there aren't a ton of sort of current outbreaks Ebola is exceptionally low likelihood. No big outbreaks that we're aware of at this moment in time. But there is certainly, like Lassa fever, for example, is an endemic pathogen in West Africa. Nigeria certainly has a multitude of cases every year. They're unfortunately not one of the teams that is coming to the World Cup. Certainly there are other teams from the West African region where Lassa fever is not an unusual pathogen. And that's why I think that that's something to bear in mind as we're going through our preparations for the World Cup.
And I think when people in the United States think about a viral influenza fever or being sick with one, they think of people being acutely ill. And we saw terrible pictures, of course, of people dying on the sidewalk or something. But with Lassa fever specifically, as you mentioned, there might be milder cases, and you might have somebody who was feeling fine. And then by the time you do all that traveling and are eating weird food or, airport food, and you get somewhere, you might not feel well. And those people might have had a very mild case. Unlike some of the other viral hemorrhagic fevers, Lassa seems to have, some people just have a much more mild case. We still want to protect healthcare workers, and we still need to think about it as a potential if they've been in these sort of, or come from an area where there is pretty constant circulation. I know it has some seasonality as well.
Most people aren't going to come in wearing a big sign saying, I have a special pathogen infection, right? And so it really is being aware of what's out there. It really is having good processes where people enter healthcare facilities to encourage patients to put on a mask if they're having illness, to ask them the questions about where have you traveled? What have you been exposed to? This is the stuff we learned in nursing school or in medical school, right? And it's harder to do in practicality than it is in the learning environment, but we really do need to do it.
Yeah. The identify, isolate, inform model, it sounds so easy, but in triage, it can get really busy and you're being pulled in a bunch of different directions. I also wanted to ask you, with your NSPS hat on with this, I know that a lot of people who use electronic medical records might have screening built in for symptoms, obviously. And then for travel, there might be some resources that are built in that help them identify where current outbreaks are occurring. But I know that this has been an issue in the past where in places where things are endemic, it might not pop up as an alert. But if you've got these things and you need to put them together in your head, even if the alert doesn't fire, we need for you to be thinking about it. But I'm wondering if there are other strategies for this. Is there a list of where places are endemic, or what's your best advice on resource for that?
That's a tough one. Because I think you're right. There's no great sort of single source of truth from it. But I think having really good adherence to infection prevention principles across the board is probably our best protection, because people aren't going to come in saying, I have Lassa fever for the most part. It may not flag in our travel screen, but just being really diligent. It's one of these things that, it's really hard to do in the day-to-day grind of healthcare. But I think it's also kind of one of the best things that we can do is just be really diligent overall to the sort of general principles of infection prevention. Wash your hands, wear a mask when indicated. And those are probably the core way that we're going to protect ourselves, because screening, I think, is an essential element, but screening is probably not a perfect approach, right? There's no way to screen with 100% sensitivity and 100% specificity, right? We're going to miscategorize people. Now, that's not to say it doesn't help. I think we definitely should screen. We should use the tools that we have at our disposal, and we should use all of our clinical training and clinical judgment as well, and adhere rigorously to all infection prevention protocols and principles.
I agree, because in the end, if somebody comes in with a fever if you have fever and cough, for instance, I don't care whether it's MERS or COVID or influenza or whatever. I don't want it. I want you to put on a mask. I might put on a mask. I'm going to do some hand hygiene. I might ask you to do some hand hygiene. I'm going to try to keep you from coughing all over other people. And similarly, if somebody comes in with like fever and like nausea and vomiting and diarrhea, I don't want that either. Therefore, I'm going to say, please use hand hygiene. Not only alcohol-based hand sanitizer, but actually wash your hands. And I'm not going to trust that your hand hygiene has been exceptional if I just watched you come out of the waiting room bathroom, right? I'm going to make sure that we are taking care of those things because the fundamentals are still true. If I can avoid contact with your blood and body fluids, I want to do that. Full stop.
Yeah, I think there's one core message that comes out of this, right? Is do what Jill would do.
That is not usually good advice. Let me just say, my mother would not agree with that
In
at all.
my world, it's very good advice.
Yes, I can absolutely say, please think about the basics. And if you're a healthcare worker, my appeal to you is source control works. Putting a mask on people really does help reduce what they spew out of them and protect yourself, because the last thing we can afford to do at the 1st of June going into World Cup events is to have a bunch of healthcare workers who are already sick with the new brand of whatever it is. So we do, not just because we want you to be at your job, we want you to remain healthy. And that means protecting yourself.
Yeah, 100%.
Along those lines, do you have any other advice for like people traveling around the country? Because even if you're going to Miami for that game, which is so important to you, you might stop in Orlando. You might go to Disney World. If you're in Texas, you might go see all the other things that there are to see in Texas. Thinking about the level of alertness that other places outside of our host cities need to bring to bear. And what advice you have for people who are traveling and what they should do to help protect themselves. I mean, we mentioned washing your hands. Are there other things that you think that people should do?
That's a tough question too, right? Because you don't want people to enjoy this amazing event and enjoy travel. I mean, travel's an amazing thing to get to do and to see other places in the country or other parts of the world. And you want people to enjoy that and move about. I think people in regions that don't have a World Cup event should not necessarily feel like they're unaffected by this event, right? And so when we think about this from the NSPS standpoint, right, we have a lot in the 10 federal regions. 8 out of the 10 federal regions do have some World Cup event in their region, okay? But some of the regions are massive geographically, right? So it might still be hundreds of miles away from other sites within the region. And then there are 2 federal regions that don't have a World Cup event in them. And that doesn't necessarily mean that they're not going to have impacts from this influx of visitors. I don't want to make this as like our only period that we should be considering these things as the World Cup, because people are always moving around, right?
Right.
Regardless. It's not a crisis, right? So I don't want to use the like never let a good crisis go to waste adage, but sort of the idea of using this as an opportunity to raise awareness. Generally, the whole point of NSPS is to raise our level of preparedness during blue skies as well, right?
That's right.
So using this as an opportunity to say, where are our gaps? How do we do better? We may not be around the context of a global mass gathering like the World Cup. It may just be through routine life that we have our next event. So I don't want to focus solely on like, we just need to prepare and get through this event, because I don't think that's the right message at all, right? It really is about making this routine day to day, getting our structure and processes in place so that every healthcare facility across the US can identify, isolate, and inform. We know who to call. We know how to get help. We have a network in which we can hopefully move patients to sites that have more capacity or capability for care for patients with high consequence infectious diseases. And I'd love the side benefit of this to be that we have less transmission of measles within our healthcare facility.
Right. No, absolutely. And I think that that's a great point, because we think about knowing what your resources are, whether that's to help you identify what this might be. And every small hospital across the country doesn't have to have an infectious disease specialist necessarily on staff, and certainly not available in your emergency room for a curbside. But we want you to know that there are places that you can then say, look, this is just not fitting together for me. I'm concerned about this patient. They might have something, knowing who you can use as a resource to say, what do you think? That can be public health. That can be your regional treatment center. We want people to be on the lookout for these things and have a pathway that they can then escalate that care just as you would with something else if it's warranted. And I've been telling people lately, just like you have to sort of get your story straight and sell a neurotrauma patient, you don't just transfer everybody who hit their head on something. You transfer the people that are appropriate and need that next level of care. And so I think in this case, be on the lookout for something and then have it already in your head who you're going to call, who's on your short list of people that you can rely on for this kind of help.
That's exactly it. Know your team, know your resources,
Yeah.
and know how to ask for help if you need it.
Yes. Yes.
I mean, that's a good life skill in general.
It's absolutely true. I mean, I think you and I had mentioned previously how important this being prepared, even mentally, having your own list in your own head. We'd like to think it's protocolized at your hospital. We'd like to think there are algorithms and who calls who and how do you do that. But if you don't have that, and I get that there are an awful lot of people interested in preparedness that may still feel like they're sort of yelling into the void at their facility. But that doesn't mean you can't have your own list in your own head. I know what I'm going to do when this situation happens. I know what I'm going to do when somebody calls and needs help. I know where I will go to for assistance. And that alone can make such a huge difference. I think if I had to tell people one piece of advice, source control works. Yes, I want to make sure that people hear that over and over and over again. The other thing is I'm just constantly amazed at watching people touch a lot of other stuff in the environment and their face. I mean, I'm grabbing a handrail and then I'm grabbing the handrail again, or, just be aware that there are cooties everywhere and you don't want to shove them into your eyes, nose, or mouth. If you could just do one thing, it would be like carry some hand sanitizer with you. If you can't remember when you last used it, use it again. Because that's the more likely route, right? Is that I'm going to touch something that I didn't realize was contaminated and contaminate myself.
Yeah. And that's not related to the World Cup in any way,
No.
shape, or form, but it's related to how do we do our jobs and how do we establish safe work practices?
Yes. And even how we interact with our environment when we're at these joyful events where we're seeing a lot of people and we're having a lot of fun, but there are portalettes and crowds and public transportation and all sorts of things that we're going to be interacting with. And that environment is going to put us into contact with other people's natural cooties. Gosh. Well, how interesting. I am also looking forward to this. I really hope that this ends up with a tremendous experience for the people who come to the United States. I hope that we are going to show out our hospitality and that people will have safe visits and enjoy the entire time.
I hope everybody has a really wonderful time with this event. It's one of my favorite sporting events ever. So I'm really excited that it's local to us this year.
Well, thank you, Laura, so much for joining me today. Dr. Evans joins us from the opposite coast, Washington. She is the executive director for the National Special Pathogen System. And we really hope that you will look for the resources in your area, in your region, with your public health. And we will put into the show notes the resource that Laura mentioned, Beacon, out of Boston University. So thank you very much, Dr. Evans, for joining me today.
Always fun to see you, Jill.
For those of you listening at home, thank you for joining us for this episode on World Cup preparation. We hope you'll join us for future episodes on all sorts of topics. Healthcare worker safety and personal protective equipment, infectious diseases. If you have questions for NETEC or ideas for future shows, please feel free to contact us at info@netec.org. Or you can find us on the web at netec.org/podcast, where you can also subscribe to future episodes and find out more about today's topic. So thank you guys, and we'll see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, a NETEC podcast, produced and edited by Benjamin Madsen, with additional support provided by Britton Clark, Veronica Lavaro, Jason Noble, and Lisa Stone. Special thanks to our guests and the subject matter experts at NETEC for their insight and guidance. This podcast is supported by the Administration for Strategic Preparedness and Response. For more information, tools, and training on special pathogen preparedness, visit netec.org. And don't forget to subscribe, rate, and share the show on Apple Podcasts, Spotify, or wherever you get your podcasts. Thank you for tuning in to Transmission Interrupted.